Hey everybody, it's Jessica DeMassa with WTF Health. What's the future health? I'm talking to the who's who of health tech and healthcare innovation. And today we're checking in with Rightway. And now you might remember Rightway from last year, like right around this time. They had just raised a $100 million Series C round led by Coastal Ventures. And we checked in then with Jordan Feldman, CEO, who is back again here today. And with him this time around, we've got Scott Musial, his chief pharmacy officer. And so they're going to give us an update on what's been going on with Rightway since we last talked to them when they got their $1.1 billion valuation, had about 900 employer clients, had just been like a year into launching their PBM offering for large self-insured employers that goes along with their care navigation business. So good to have you guys here. Pleasure to have you.
Hey, Jessica.
That's good.
All right, guys. Well, let's dive right in. Jordan, I want to hear what's going on. So, like I said, we last talked to you on that fundraise. And at that point, you guys had kind of been under the radar. I mean, we've heard a lot about Accolade, Transcarent had just kind of come around. And it's like you guys have been in the care navigation business for a while, I think since 2017. You had added on the PBM part of the business in 2020. And then you and I spoke. So get us up to speed on what this last year has been like at Rightway.
Yeah, absolutely. It's been an exciting one. It's been a bit of our coming out party in a lot of ways. On the heels of our Series C, we said we want to build our brand, we want to build our profile, and we really want to celebrate all of the great stuff coming out of Rightway. We were starting to see those results that we were really hoping for on the navigation side, on the pharmacy benefit side, but most importantly on the harmonization, on the synchronization of what we believe our broader vision to be, which is how these converge such that we can most effectively manage that member experience, manage that enterprise healthcare spend. So over the last year, we've added hundreds of clients. We've seen the results of our care navigation business and PBM business continue to improve. But I think most specifically, we've seen clients that we've been able to support with our combined platform really start to prove out that hypothesis that this harmonization of care navigation plus new to the world PBM should and will be the winner in the space, supporting members longitudinally across medical and pharmacy in a way that the carriers and PBMs that have all merged haven't been able to do, and we have. So we're super excited about those results, the growth, the team we've put in place, and looking forward to digging into that today.
All right. Well, tell me a little bit right there. I want to hear about like this. What's the secret sauce here then on this combination of the care navigation plus the PBM piece? Like you said, the other carriers, the other PBMs that are not doing this. Go a little bit deeper there and tell us what's so special about the way that you guys are approaching this.
So you remember from our last episode that we started in care navigation and we had that very privileged position of working with our members, but also recognizing where spend was increasing disproportionately. And, about a third of our interactions and the fastest growing part of spend was in the pharmacy benefit without a lot that we could do. And we said that we need to wrap our arms around this. We need to reduce all of the dependencies and build something that can support this massive use case that care navigation really couldn't comprehensively support. So the secret sauce around it is really just the member experience. It's really understanding what is that trajectory and archetype of a healthcare member and where are we falling short of best supporting them. So we kind of tore down all of the infrastructure that's getting in the way of a seamless, elegant, empowered member experience and said, we're going to build it the right way, if you will. And how that was designed was by having navigation as really the digital front door, integrating with the point solutions, the carriers, the digital therapeutics, but owning this, big, important part of the experience, which was the PBM. And, that connectivity, that harmonization of medical and pharmacy has been able to support the member really better than anyone. And I think what we're doing on the pharmacy side has really, complemented and supplemented so much of what it means to do care navigation in a way that really has never been done before.
All right, this is where we're coming into the conversation. Yeah, I can see it.
The one thing that I wanted to, kind of add to that, Jessica, is that don't sell short that we operate on a single platform. So we're not having to jump between systems to take care of people, to answer their questions, to outreach to them. Everything inbound, comes through a single pipe, whereas in all the big carriers, it's multiple phone numbers, multiple systems, multiple points of entry, and that just confuses everybody. And so it's one of the things that, kind of really makes what we've built, super precious.
All right, well, let's talk about the other super precious thing that you've built here, that PBM piece of it. And Jordan lovingly referred to you as the Godfather of PBMs. And so this is why you're here, Scott. Let's hear about the PBM and let's hear what you guys have done that's so different than what's out there currently. And for those who, maybe like wondering, pharmacy benefits manager, like what is that space? It's like, it's always kind of been like a black box in healthcare. And so let us hear what's going on at the Rightway's PBM.
Yeah, I wish I had 3 hours to explain everything, but we don't. And so trying to distill it down, I think the first thing that we wanted to do, Jessica, was launch off of our, legacy perspective of really wrapping the member with a great experience and helping them navigate through a very complicated benefit. 65,000 pharmacies, greater than 30,000 drugs approved in the United States. Millions of prescribers, everybody's really confused and they need expert guidance. And so that's where the legacy of Rightway begins to make sense. The second thing that we had to do is we had to construct a business that didn't have all of the misaligned incentives. If you're CVS, you want to drive volume to the CVS retail, to the CVS specialty. We don't own retail. We don't own a mail order. We don't do any of that. So we can navigate an individual to Amazon if that's the lowest cost place of service for them and they appreciate that type of member experience. And then the last thing that I would say is everybody is historically focused more on what is the price of a drug. And we really believe that you have to not only manage price, but you have to manage utilization. Are there lower cost alternatives that could be used, like biosimilars? We're fanatical about getting individuals off of innovator drugs and onto lower cost drugs. And we don't have any revenue tie-ups, when that happens. In the big PBMs, they start losing rebate revenue, they lose dispensing revenue. And so we have to do all of those things. And when we put that all together, we get clients that are saving 18% in their first year. We get member satisfaction, net promoter scores that exceed 80 for us. We get all sorts of really, really good responses, including, kind of member commentary that comes in to our organization on a daily, weekly basis that says, thank God, I can interact with pharmacy experts, and I don't have to do that in a cashier line with 3 people behind me.
Yeah, listening to every word. That's always my favorite part.
Exactly.
Scott, I want to ask a quick follow-up on something that you said that I thought was really interesting because I hadn't heard it put this way. But you said usually in the PBM conversation, there's a lot of focus on the price of the drug as opposed to utilization. And then you said that you guys are able to see 18% in terms of cost savings. How much of that is made up of the navigation piece that sends somebody to the right drug, improving utilization, versus the, hard-hitting negotiating skills that you've got to negotiate better deals on price of drugs? Like, give us a sense of like what's really creating that 18%.
Yeah, if you broke it down, about 20% of it is, kind of more efficiency purchasing and passing through that. 80% is us doing the hard work.
Okay.
And it's really important that when you do that work, you can't, like historically health plans would go, hey member, you can't use this drug, follow up with your doctor. They don't have the ability to really talk through with the doc what needs to happen. So our approach is, let's talk with the member about the opportunities that are in front of them to save money. And if they say, I'm interested, we go, we got it. We'll take it from here. We do everything so that it's very easy and supportive for them to do these sorts of switches.
Jordan, who are you guys working with these days? So, last time I talked to you, 900 employer clients, which I thought was really impressive. You guys were working with companies like Kroger and Burger King. Like, where are you guys at now? Like, give us a sense of like who some of your big name clients are. And then also, I hear you guys are talking to payers about letting them use your technology. Like, tell me what's going on here with this client mix.
Yes, so we've grown the Rightway platform. We now work with over 1,500 employers. So
wow.
We're really proud of that growth, and we're seeing it on the navigation side, we're seeing it on the PBM side, we're seeing it on that kind of unified side, and we're also recognizing that the payer market is an attractive opportunity for us. I think, they're tired of their legacy PBM setup. They're tired of, having a great healthcare plan in the market and then using one of the big three that they may be competing with on the other side of the house. So we've seen more impact. We're starting to have a lot of success in that market. And, I know it's one that Scott's super excited about as well.
And I would add to that, Jessica, that health plans really think about, kind of engagement and execution down at the member level. And so they're always looking for, kind of what are the best tools that they can use to drive campaigns, whether that's a gap in care closure or a cost savings opportunity, or purely member engagement to drive up, their CAP scores so that they get, kind of a better Medicare star rating that drives their premiums. And so the payers are now really acutely tuned to, kind of almost the lifetime value of that member and how experience plays into that lifetime value.
Let's talk for a minute about the competitive landscape here, because it's been, I can't imagine, like in the larger context of what's going on with employers and how they are trying to retain employees that they have or attract new hires, in this whole great resignation kind of landscape. I want to talk though about like where you guys kind of fit into like the other options that are out there for an employer in terms of who they can choose to work with for navigation. So it's like we've got Accolade that's out there, Transcarent, Glenn Tolman's company, Included Health. And, I'd like to hear from you guys, what you see as the key difference between Rightway and those other navigators that are out there. Scott, do you want to start?
I'm happy to start, and hopefully I get this perfect for Jordan.
You just set him up.
Yeah, I think exactly. Thank you for that. I think the first thing that we think about is that we want to be able to have, kind of really strong engagement, really strong clinical impact without all of the disruption that comes with some of these other models, swapping out utilization management and different things like that. And so we pride ourselves in this, kind of twice the impact, half the cost, all of the clinical perspective that we think is really important. That's kind of number one. Number two is we pride ourselves on the engagement of the member being driven by people and top of licensed people. So when somebody comes in and wants to talk to a nurse, they're not going through the call center to somebody who then routes them to the nurse. They get right to the nurse to have the explicit conversation, or right to the pharmacist. And people might go, oh my gosh, it sounds like, you'd be really expensive to run that. No, you know what? Actually, with a little bit of smart technology, you're able to route those things pretty efficiently. And so those are the things that I think of as being, kind of highly differentiated. Jordan, what do you think?
Yeah, Jordan, how do you do?
I give him an A.
All right.
So much of that captures why we built Rightway. When we built Rightway, some of these legacy players were out there and they weren't driving engagement. They were mostly call center based. They didn't have that digital component, that smarter clinical model, highly disruptive. But, look, right now with the platform we've built, we're looking at building Rightway into more of the workday of the enterprise ecosystem versus maybe a single threaded point solution. We obviously believe strongly in navigation, but, Accolade, Included, competitors as much as CVS, Optum, and Express Scripts. And, we are looking at the Rightway platform as that kind of single most comprehensive platform within the enterprise ecosystem that's supporting around medical and pharmacy. And we think with the combinations of our different deliveries, we can create that. So, we are trying to create, obviously we're hand-to-hand combat with, these two parallel paths, but, we're trying very much to elevate out of that, because we think that this delivery model is where employers are going. I think them contracting with 15 different solutions and having all of these different arrangements, that's not the future. They need to situate medical, they need to situate pharmacy, they need to have everything wrapped and bundled. They need to make sure that the member is supported with them imposing their will on the experience versus, thrashing to these 20 different places they can go. And, I think that's ultimately what's going to emerge out of the last 2 or 3 years, where it's just been this onslaught of different options and competitors and point solutions. One of the guys on the Rightway team jokes that there's now a point solution for left-handed diabetics over 6 feet tall. And, we need to kind of get out of that mindset and say, let's put the member at the center of that experience. How are we going to support them? We're going to do that with the Rightway platform most comprehensively. And, we think that's the winning model. We see on both sides of the house a little bit of the innovator's dilemma in terms of how they're going to be able to keep pace with what we're doing. So we're super excited.
Yeah, the other thing that I would add to that, Jessica, you're talking about kind of how employers are making, making this decision on who they use or why they're making these decisions, is more so now than ever. Kind of the fulcrum's moved away from what cost impact are we delivering to what member experience, and how do I make this a very attractive benefit, a recruiting and retention tool. Our RFPs are constantly asking us about kind of how can we deliver all of the impact without any of the disruption. And we pride ourselves in being able to kind of thread that needle with the type of support system that we've created.
To follow up on this, I'm curious too about like your own financial relationship with the employers. I mean, like obviously, it's like they want all of this, but it's like, what's the payment model like for you guys? And I ask this because I feel like in this last year, we've seen a little bit of a shift towards more at-risk type models. Like Accolade has started to do their own more at-risk, even though they do still charge a fee for like a per member per month kind of deal. But Transcarent had come out fully at risk at first, and I'm not sure where included is that in this, but where's Rightway in all of this? Like, what does your model look like?
Yeah, right now we are on the PM admin model. On the navigation side, we do take risk and we put fees at risk. I would say on the PBM side, it is more innovative and probably differentiated to approach it with a PM model. Historically, it's been rebates driven, it's been spread pricing driven. Ultimately, what we believe as a company is, we're a technology platform, and obviously we have the people that support it, but in the same way that you pay for software for providing a service, we believe very strongly that we want our core capabilities to, have that admin fee, and then we're willing to put everything else at risk. We're willing to put skin in the game. We want upside. We want a piece of those cost savings, and ultimately don't believe we should be making any money if we're not making an impact on that total cost of care. So I think all of our structure, all of our delivery, all our financial model really reflects that process. But Scott, what would you say there?
Yeah, well, I would say the one thing that the employer group space, or really even health plans hate, is at the end of the year, there's a settlement that says you owe us a big chunk of money. And oftentimes that liability on the employer group may not have been booked properly. And so it creates all sorts of confusion. I've lived this life. I was an early in executive at Evelyn Health, and that's all we did was run, kind of value-based contracts. And they were very, very challenging to kind of get settled. And so I do think the marketplace wants predictability, and they want to see the value and the return on investment with that predictability. It's easier to budget. It's easier to kind of manage through an approval process, all of those sorts of things, versus surprise, you owe us $19 million or whatever the shared savings is at the end of the year.
Yeah, I know nobody likes to be hit with a surprise bill, right? That's like a core truth in healthcare.
Well, I'm pretty sure they have a new legislation to prevent surprise.
Yeah, right.
Yeah, we've got businesses that are building their model on that. It's kind of crazy.
Jessica, one thing that's really helped us win, particularly on the PBM side of the business, is we've asked every client that we've spoken to, show us a year of claims data. What did you spend last year on your pharmacy benefit? We will guarantee 15, 20, 25% cost savings. and put dollar for dollar. And I think the beauty of the PBM cost savings is it's hard dollar savings. You know,
Yeah.
I know you said that navigation savings could be a little bit squishy. The CFO may have a very different view than the total rewards. The reason we've won so much PBM business is we've been able to look at historical spend, the buckets of 18, 20% savings that Scott outlined. We've been able to take that cohort and say, we're going to save you this much here, this much here, this much here, and we'll fully guarantee it. And from that perspective, it becomes a win-win for the employer. Hey, I can save 20% on the fastest growing part of my healthcare spend, and my members are going to get a better experience. And that's what we've introduced into the market, and it's starting to get a lot of enthusiasm around it.
Guys, what can you tell us about employers? What's going on? Like, I mean, they have been hit so hard through this whole pandemic, making a million different decisions about things, like everything from, back to the office, do we have an office, all the way, I'm sure, down to health benefits. I mean, and doing it in a time when people are, switching jobs, leaving the workforce altogether. So what are you guys hearing from employers specifically around health benefit? Like, I mean, generally speaking, like, I'd love to hear what's going on. Like, what are some of the conversations you guys are having? Like, dish for us.
I think one of this just happened last week, Jessica, and it really summarized, kind of in a nutshell, I think, the past, 2 years of interactions working with the CHRO, and literally she said, if you can't push the easy button for me, I just don't want to do business. So everybody is looking, kind of for that easy button that doesn't create drag on their system, that is, kind of delivers what it says. And that to me is part of the beauty of, I think, how we've approached this, is we are trying to make it very easy to do business with us. Jordan, what about you?
Yeah, I've seen a lot of, defense to offense. I think
Okay.
what it did was it put HR on the defensive. It kind of took the HR suite and said, wow, we have more to react to than we have resources or bandwidth. The HR folks were, elevated to the most important parts of the organization, but they were playing defense. They were reactive to kind of the global macro situation, and that trickle-down effect around mental and behavioral health and stress and churn and the Great Resignation, and they were trying to keep up with it. And if you would do a survey, they'd say we're trying to do twice as much with half the amount of resources, even within our HR teams. So I would characterize the last 2 years as kind of blinders on and playing defense. Now, what I'd say about maybe turning the page into 2022 is we've seen them kind of take the blinders off and say, you know what, we've kind of situated what we've had to deal with over the last 2 years. There's predictability. Now, I'm not going to necessarily say that, we know everything that's going to happen at this point, but I think predictability has given them the confidence to say, okay, what is our long-term strategy? What is sustainable? We kind of made all these, what I would argue are kind of knee-jerk reactions to these last 2 years. But, that's not necessarily what's going to win the next 5 years. And, I think so much has changed and evolved in these last 2 years that they haven't even had a chance to fully appreciate it and really project out on what they believe the future is going to look like. So I think this gives them a real nice reset, a real nice point in time to say, okay, now that we've kind of come out of this, what is our 5-year winning strategy? What is that approach? And that's allowing them to think about these different strategies that may not be that acute reaction to COVID, but are more, how are we going to win the future for our employees and our healthcare strategy?
I think that's very well said. I feel like that's been the sentiment, like, for a lot of businesses. And I would imagine it's got to even be, partly what you guys are feeling. I mean, you had to scramble and react. So let's end this conversation here. I want to hear about you guys. Like, how are you resetting, and what's next for you as you look at 2022 and beyond, and like adjusting to kind of like the new era of doing business in this post-COVID-ish world? We're not quite post, but post-COVID-ish.
Yeah. So look, we are we are focused on building that category defining healthcare company. And that is our, that is our primary objective right now. But in doing that, we need to have the people, we need to have the infrastructure, we need to have the, mentality from our employees to go out and achieve that big, bold, and ambitious agenda and initiatives. So, we're doing lots of stuff to support our people. We, fundamentally believe that we're only as good as kind of the group we put around ourselves. And, we're trying, we're iterating, we're testing, we're taking feedback. I sadly don't think there's any one right answer or magic bullet. And, we're really just trying to react, adapt, stay iterative, stay dynamic, but really just supporting our people, spending time with them, listening to them, making sure that they know that we're there for them, making sure that they're, fulfilled by what is going on at work, and, being the best support infrastructure we can for kind of everything they have outside of work. But Scott, you spend a lot of time in this space also.
Yeah, the only thing that I would add to that is I think we're doing a lot of test and learn still, Jessica. And so an example of that is we've got, kind of member engagement teams that, are coming back into the office working in, kind of the traditional environment. And then we still have ones that are working, kind of 100% remote virtual. And we're trying to understand what are the impacts on our team members in both of those environments. Some people are just like, I gotta get back out of the house and be able to see my peeps and be able to, kind of have a potluck in the office. And others are like, you know what, I'm kind of chilling with my slippers and, kind of my PJ bottoms on when I'm interacting with the members. And so we're still, kind of open to doing a lot of different test and learns to figure out, kind of where our employees feel the most productive.
Yeah. That's interesting. Well, thank you guys so much for dropping by. It's nice to catch up and hear how things have been going in this year for you. I mean, it's impressive all of the growth that you've achieved, and really excited to hear about all the headway that the PBM is making. That's really exciting stuff. I love covering this space because there's like so few PBM businesses to talk to. So it's like exciting to me to hear about what's going on in that space, and hearing especially that you're making a difference in terms of the way people are accessing drugs and able to make them more affordable to them as well. I think that's just fantastic.
Thanks, Jessica.
All right, well, we will talk to you guys soon. You'll have to stop back as soon as there's another big update. Until then, folks, this was the team at Rightway, Jordan Feldman, their CEO, and Scott Musial, their Chief Pharmacy Officer. I'm Jessica DeMassa, and for more interviews with the who's who of health tech, you can check out my YouTube channel over there at youtube.com/WTF Health. We'll talk to you guys soon. Thanks again for joining me. Bye.